So glad to have everyone. Let's go ahead and get started on this chat today. Just a reminder, if people are wanting CME credits, here is the route to get them. And if people need that afterwards, feel free to let me know. I think that you can text this information by midnight tonight or 11 p.m. tonight. Okay, so remember, feel free to chime in if you're having trouble hearing us, seeing us. If people would like to chime in with a question, it would be helpful if they want to raise that in the chat, and we'll be sure to get to it. We love seeing people's faces and cameras on, but certainly don't have to. And like I said, we will do questions towards the end. We already got introduced to a few new people. And today's agenda, we're going to do a brief didactic like always. We're going to talk about a couple cases, and then we're just going to review the upcoming lectures. And today, as many of you may know from the flyer, we're going to talk about some evidence-informed approaches at addressing the psychological sequelae of COVID-19. And I'd like to emphasize evidence-informed approaches here, because we need to remember that this evidence is really just emerging as we're talking right now. We're all adjusting to this in real time. So a lot of the evidence for these approaches comes from expert recommendations, previously studied approaches, as well as very preliminary data from studies that are being published every day. And I want you to think, as we go through this, about what the best evidence-based approaches are. I want you to think about identifying different populations that might benefit from different levels of care or different approaches, and then evaluate some strengths and weaknesses of the ways in which we approach these conditions. As a review from last week, we know that COVID-19 has impacted quite a number of people in the behavioral health realm. We've seen pretty significant increases in affective disorders, particularly anxiety disorders towards the beginning of the pandemic, and we're seeing more increases in depression and suicidality towards the latter stages of the pandemic and where we are now. We're also seeing increases in substance use, particularly cheaply made substances, and we're seeing quite a bit of opioid use. Now, as this has unfolded, we all know that we've seen disruptions in healthcare service delivery. So that impacts everything that we try to do from our end. It's difficult for people to get access to care, particularly people with complex, difficult presentations. And we should also remember that there are quite a few at-risk populations that we need to be vigilant for. And I've listed quite a few of them there. I'll note that people who have come into the pandemic with pre-existing health problems are at increased risk. People in marginalized groups are, of course, going to be at increased risk. Unfortunately, we're seeing frontline healthcare workers and essential workers experiencing quite a bit of burnout and strain. And we're also seeing people in certain demographic groups like youth who are at increased risk for behavioral health issues, parents of school-aged children who are dealing with quite a bit on their plate right now. And we're seeing that females are showing quite a bit of increased risk for affective disorders, while males are showing an increased risk for suicidality. So let's get into some strategies a little bit. Now, given that most of you are family medicine providers, I want to think about the bread and butter approaches that you're going to want to use in most of your patients who are experiencing mental health issues right now. So the best advice that you can give for these patients boils down to just a few points. With patients who are experiencing a lot of anxiety and stress about the pandemic, one thing we need to focus on is limit sources of stress-inducing news. This can come in several different flavors. So with patients who you might suspect are getting suspect sources of information or inflammatory information, we might offer that this information is potentially negatively impacting their health, and that they seem to be getting quite worked up about these issues. So maybe in the pursuit of not getting as worked up, we could limit our source of information to maybe one mainstream outlet. Reassure patients that you'll still be getting the news, but let's try to cut down on the number of news sources that we're getting. All these online searches for COVID rates or vaccination effectiveness. Maybe we could try to limit that a little bit and just watch a little bit of nightly news and get our sources of information that way. We should also be, of course, counseling people on limiting the amount of time that they're consuming news. In reality, we're not learning anything new on a minute-by-minute basis right now, and people can get a daily update on how things are going with just short exposure to the news. We should also focus on breaking social isolation. This is a big point that's going to come up over and over again. We ought to remember that as we enter this new phase, that we've been isolated for quite a long time. And one of the best things that we can do for this is to remember that we are social creatures. We crave social interaction, and we need to give ourselves that dose because it really helps us maintain our health and well-being. So for patients, this might mean they need to schedule times in which they engage with friends and family. If that's an in-person meeting, that's a telephone call, it's a video conference, they need to force themselves to really break out of this cycle of isolation and reconnect with the people around them. Because evidence consistently shows that social connection is a strong predictor of psychosocial health. We need to encourage people to maintain or reestablish their healthy habits that keep them going on a daily basis. As we've gotten isolated, as people have been working from home, it's been really easy to sort of drop the ball on those habits and everyday routines that we do that keep us healthy and happy. Things like sleep hygiene. As we work from home, it's easy to sleep in maybe a little bit later because we don't have to commute. It's easy to stay up later. It's easy to take naps throughout the day. Things like that are negative for our health and functioning. So keeping a strict sleep routine and focusing on our sleep hygiene would be beneficial. Getting back to exercising, eating healthy. Bottom line, if you're not taking care of yourself in these basic domains, you're probably going to have some difficulty functioning. And finally, we need to encourage people to seek and ask for professional help, that it is normal right now to be having some difficulty. Asking for help is not a personal weakness. Following this, to build on some specific strategies that I think people ought to take advantage of, is they need to build on their existing social support systems. And as a clinician, you can leverage this by bringing family members into the picture as much as possible. Roping family members into coming to sessions or being a source of accountability for patients can be very, very helpful. We also need to, like I said, normalize difficulties right now, that most people are encountering at least some level of difficulty right now, and it's totally normal to seek care. And then when people do say they're having troubles, we need to facilitate their care seeking at the appropriate level. So for some patients, this might mean they need to do a little bit of self-directed care, and there are ways in which they can do that. For others, maybe they need to just engage more with the healthcare system. They need to have more routine appointments or phone check-ins with their providers. They can do that through a variety of means, particularly as telehealth is widely available. Or maybe they need specialist level care. Now, some specific outcomes research that I want to discuss with you. I'm missing a couple of my illustrations here, but we'll just make do. So there have been several randomized control trials aimed at different approaches that sort of inform us as to where we should be directing our patients. Now, of course, individual psychotherapies are great. We have very well developed technologies like trauma-focused CBT, behavioral activation, and other medication approaches that are very effective for people with affective disorders, trauma-related disorders, or suicidality. But as the pandemic makes delivering some of these things more difficult, we need to focus on alternative methods of delivering care. Things like hotlines, peer support groups are quite effective for people who are in acute stages of distress or crisis. And as well, there's a proliferation of mobile and internet-based technologies that are showing good evidence for their efficacy. And so this can be a really good place to direct clients who may be experiencing some level of impairment, but are on the higher level of the functional spectrum and maybe don't need a high level of care devoted to them. Now, I had a couple pictures of some of these technologies that I'd really like to promote to you today. And these are going to be mobile health applications that are best for things like depression and anxiety. Many of you are probably aware that there are a ton of mobile apps out there for just about everything under the sun. And you may question how well these things actually work. But as we've had these things for quite a while, they have been the subject of quite a bit of scientific scrutiny, and some of them have really emerged with quite a strong evidence base. One of the ones that I wanted to mention that I had a nice little illustration of up here, and these are all detailed on our website under our resources section, so you can check that out at a later time and sort of decide which are the right mobile apps for certain patients. One that's titled Mood Mission, available on Apple and Android. It's generally effective for people with depression and anxiety disorders. It utilizes a CBT approach and works quite well. Another one I wanted to mention that is somehow missing from this slide, even though it's on my personal slides, is an app called Headspace, which is a mindfulness-based intervention. It boasts quite a lot of evidentiary support for quite a few health conditions. So many of you have heard of mindfulness. It's quite effective for quite a bit of different psychiatric issues. It's available on Apple and Android. Like I said, point people in that direction. But one of the ones I'm most excited, and I'm glad it's showing up, is a technology called Virtual Hope Box. And this is an application that has been assayed with several RCTs, and it is quite effective for improving emotion regulation and distress tolerance, particularly as that relates to suicidal ideation. It's called Virtual Hope Box because it's really aimed at improving hopelessness and symptoms of just losing one's connection with others and their grip on their daily life. So it encourages people to upload pictures of their friends and family, to get daily reminders and text messages about the things they care about in their life, the things that they're working for, and reminders to, hey, go call a friend, connect with this loved one who you identified as a person of support. And it's, again, it's really quite effective. I see Caitlin Leckie has shared the Headspace link. Thank you for doing that. Like I said, we have detailed these on our website, so where you can download them, the evidence base, and everything. Last thing I want to mention here is that with telehealth, the evidence generally with telehealth and mobile health apps suggests that patients really love these. They respond really well to telehealth. There's really little evidence that these interventions are less effective than in-person interventions. But on the downside, particularly with telehealth, it puts a lot of burden on clinicians. And I certainly would love to hear y'all's input on this, as you've done a lot of clinical work in this domain. But it becomes very difficult to maintain these technologies, to make sure that they're HIPAA compliant, that you can actually get patients on the line. And there's always worries about whether we can get properly reimbursed for these. So telehealth, while it's great, it does have its downsides. I want to briefly go over some issues related to crises and threats to safety. So we talked a lot about suicide on our last lecture, about how suicide rates appear to be continuing to increase at a somewhat alarming level. And with that, we should mention that evidence shows that more people now than ever before in the United States, this is particularly true in Texas, have access to lethal means, particularly in the form of firearms. So many of you may be aware that gun sales have increased quite a bit over the last year, and this may be particularly true for a lot of clients. They may have a lot of firearms laying around the home, particularly in unsecured locations. And the evidence continues to show that when people have access to lethal means, it makes it easier for them to successfully complete suicide. So that should be something on your radar as someone admits to undergoing to having some suicidal ideation. Another reminder is that the best predictor right now of success for people who are experiencing suicidal ideation is social connection. People who are well socially connected, who have supportive friends and family, they tend to do pretty well regardless of the severity of their illness. Whereas people who are isolated, they tend not to do so well. So this is an opportunity to leverage an ongoing support system with people who are experiencing suicidality. Some specific targets I think that you can look for are ensuring as best you can that people have access to care, increasing their social connectedness as best you can, making sure that they have people in their lives who are aware of the issues, who are keeping them accountable, and that they're scheduling regular times to connect with people. We also need to think about reducing access to lethal means. So people who have guns, we need to think about strategizing with those folks about reducing their access to that firearm. So that might mean putting them in a safe and giving your partner the key. Maybe even letting a friend or a neighbor take care of your firearms while you're undergoing these difficulties. Any way that you can sort of distance that individual from that lethal means is going to be an effective strategy. We should also obviously address substance use, financial strain if it's going on. Those are huge contributors to suicidality. So maybe informing a patient that when they're intoxicated, they tend to be more prone to rash, impulsive decisions, and so that's a high-risk activity that they need to be specifically vigilant for. With financial strain, I think we need to work to connect people to social work and job placement resources, at least getting people thinking about taking that first step to trying to right the ship in their financial situation. And then lastly, I want to mention domestic violence, because it's a huge issue right now. And when you hear about it, I think it would be nice if you're armed with a few resources that you can connect patients with that they could take advantage of to help them through that really difficult time. I'll really promote the National Domestic Violence Hotline. It's a really, really great source for folks who are in those terrible situations. They have a hotline that people can connect with. It doesn't show up on your phone bill, which is really nice, particularly for people who have partners who may be a little bit nosy, and they might fear that, well, if I reach out to one of these resources, my partner's going to find out. They can be a little less afraid of that with this source. They also have a texting line And I've included information about how to access that texting line. I believe it's number 88788, and people can just send a text saying start to that line, and they can engage in texting. It does not show up on their cell phone bill, so that's another benefit. They also have online forums and social support resources for people who are going through this. So that's a really, really good place to start with domestic violence, as people can just connect with someone who understands what they're going through and isn't going to pressure them into leaving their spouse or anything like that, because we know that when we pressure people in those situations, it doesn't tend to work that well. Also, I've included the National Suicide Prevention Hotline. I can't speak highly enough of this resource. They have counselors on there 24/7,